COVID-19 Health Summit.
Partnered by LIC. हर पल आपके साथ.
The world is facing an unprecedented crisis. The virus that emerged from Wuhan, China, continues its deadly spread. The COVID-19 crisis has wreaked havoc on a scale most of us could not have imagined. Coronavirus has caused significant loss of life, disrupted livelihoods, and damaged the global economy. Closures mandated by governments to slow the spread of the virus have resulted in children not attending school, cinemas being shuttered, flights being grounded, and people being separated from their loved ones. As many countries gingerly start lifting their lockdown measures, there is a glimmer of hope. Vaccine trials are in full swing. Coronavirus may be relentless, but so is the human spirit. People have adapted to the new normal, masks, sanitizers, and social distancing, but they can't wait for life to return to normal. So when will the pandemic end? On this session of the COVID-19 Health Summit on WION, health scholars share a global perspective.
Welcome to the COVID-19 Health Summit. I'm Akanksha Swaroop. The impact of the coronavirus pandemic is being felt across industries, heralding some irreversible changes to come. So much so our summit today is a webinar and not a public engagement, which it otherwise would have been. Despite the full backing of governments and communities, public and private healthcare systems are fighting an uphill battle against a largely unknown enemy, while also coping with the lack of adequate personnel and resources. In this session, Coronavirus, when will the pandemic end? We explore what we know so far about the novel coronavirus and the key steps healthcare providers need to take to enhance their preparedness for this global crisis. On that note, let me introduce our esteemed panelists. Dr. Elisabetta Gruppelli, virologist and lecturer in global health at St. George's University of London. I'm also joined in by Professor Lorenzo Gostin, Director, World Health Organization, Collaborating Center on National and Global Health Law, and Professor Amos Bennett, a virologist at the Faculty of Medicine, the Hebrew University of Jerusalem. A very warm welcome to all three of you. Mr. Gostin, if I may begin with you, let's begin with the most obvious yet the hardest question for experts to predict in terms of projections. When can one expect the pandemic to end?
Well, I'm always asked this question, and the truth is nobody knows, but it's occurred to me that we have a pretty good idea approximately when it will end. If we look at the historical precedents, particularly the 1918 influenza, great pandemic, and other kinds of contagious disease pandemics, it'll probably have a trajectory of about a total of 2 years. So we're about 6 months into it now. I would expect about a year and a half from now for us to emerge out of it and get back to somewhat normal. Now, I know a lot of people think that that is, pessimistic, but I think it's also realistic. And at least we know that this will end, but it's going to take time. The other thing I want to say importantly is that COVID-19 will not just disappear. It will be part of our lives, all of our lives, for the rest of our lives. But we'll be able to manage with it with a combination of vaccines, better treatments, and more herd immunity. And so I think this will just be part of the background of our lives going forward.
Right. So that's quite a takeaway over here, that it's COVID-19 is here to stay. Dr. Gruppelli, let me come to you. I bet you will agree that this is truly a novel coronavirus. I'd like you to begin by highlighting the complexity of this virus and what diseases can it cause.
So absolutely, it is a novel coronavirus because we've become aware of it only at the end of 2019, and therefore we started naming it like the disease COVID-19, and the virus then obviously there wasn't a name, and now it's been named SARS-CoV-2. So we know that it's a coronavirus, so we do have insight into its genome organization and also what the virus looks like. But I think we have been, many of us, and possibly all of us, have been very much surprised by the variety and the constellations actually of symptoms and severity of symptoms that this virus is able to cause. Coronavirus, this particular coronavirus is primarily a respiratory infection, at least to start with. But we have seen that it actually goes way beyond the respiratory tract, so much that actually implications of other systems, including the kidneys, vascular systems, and also when it comes to cardiomyopathies are all involved. And this is due to the virus itself, but also especially to actually the response that our immune systems do.
Right. Professor Panett, if I could bring you in on this, would you like to add something? Also, how similar is SARS-CoV-2 to the common cold and flu viruses, or should we think about the coronavirus differently compared to flu virus?
Yeah, I think that the two viruses, first in terms of their families, are completely different viruses. The only common theme for these two viruses is that they are respiratory viruses, meaning that they infect through the nose and then goes to the lung. But in terms of their composition and in terms of their effect on us, it's completely different. The influenza virus first infect everybody, including kids, and cause disease in kids, mostly infecting kids and in old people. This virus, for some reason that we don't understand, causes disease in older people, more severe disease in older people, but for some unknown reason, it infects but doesn't cause a severe disease in children and young, healthy people.
Professor Gostin, between January 2nd, when the full genome was first decoded by China's government lab, and January 30th, the day WHO declared a global emergency, valuable time was lost, which accelerated the virus spread. A recent investigation, in fact, by Associated Press has also revealed that WHO officials, despite the public plaudits, privately acknowledged China's delay to share precious data. Do you acknowledge China's delayed response?
I don't blame WHO. I think WHO was caught in a bind. But I do think that China did many wonderful things. They did sequence the genome of the virus. They also acted with a lockdown that actually brought the epidemic in China under reasonable control. But it's very clear and becoming increasingly clear that there were many weeks and very, very possibly even months where the virus was circulating without being reported to the World Health Organization. And so we did get a late start. There's no question about it. China was not fully transparent early on. That much we know. As I say, there are great things that China did,
right,
but there are also real worrying features about China's transparency.
Right. I'm glad, Professor Gostin, that you've at least acknowledged the lack of transparency on China's part. Wouldn't you agree that an investigation into the origins of a virus is imperative and instrumental in finding a cure to the virus itself?
Well, interestingly, I'm not sure if you're aware, but the World Health Organization has recently sent a joint mission to
and
actually...
since you have just mentioned that, the WHO team constituted to probe the origin of the virus in Wuhan has not been given the permission to conduct field reports. Does that restrict the probe, and will the access get hindered by the flood situation?
Well, I think, my view of finding the origin of the first zoonotic leap of the virus is that it was very, very important, but it's going to be virtually impossible to do now. The reason for that is we've done too little, too late. Very early on, China closed down the market in Wuhan, scrubbed it clean. It's like going back to the crime scene 6 months later when the crime scene has been completely changed. And so I actually believe that the origin of the virus is going to continue to be largely a mystery. We're never going to get to the bottom of it. We should have gotten to the bottom of it earlier on with a very rapid WHO investigation allowed by China. That didn't happen. But I think what we do know is that, the great probability is that there was a naturally occurring zoonotic leap from a bat through an intermediary animal, perhaps in the Wuhan market, that led to the spread of this coronavirus.
On that note, let me bring in Dr. Grappelli over here. Doctor, how would you compare this pandemic to others in history? I know Professor Panett just said that you cannot compare it with other pandemics, but I think I must. And now that the world is a smaller place, has quick transportation played a key role in its global spread?
Absolutely. I'll just start by absolutely concurring it from my fellow speakers. Absolutely. There is no way that we can compare this situation with anything. And therefore, we've heard so many times the word unprecedented, because that exactly means there is nothing like this that happened before. Transportation, absolutely. Viruses are human pathogens in this particular case, and they travel with humans. And we are amazingly interconnected in this global world. And we have seen now there is the solid data actually that looks at the genomes of the viruses that actually tell us a little bit more about actually virus distribution. And that has been, we know, for example, in the UK, actually there's a study that shows that the virus has been introduced in the UK more than 1,300 times, and all of those events actually come from traveling from abroad. So absolutely, transportation, human movement all over the world certainly has facilitated the pandemics, and is something that we must absolutely take into consideration when we look at the future. Nothing like this has happened before, but we do have to expect that something like this will happen again.
Professor Panett, a study conducted in London's King's College has found out that immunity post the infection won't last very long. What, according to researchers, could be a long-term and effective vaccine to COVID-19?
Well, thus far, there were 3 recent papers, actually from last week, showing results of 3 vaccines.
Right.
One from England and 2 from the United States that have gone through a safety experimentation, what is called phase 1 studies.
Right.
And the 3 of them have shown safe injections and safe response from the population. Not completely safe, but acceptable.
Right, but Professor, those trials are yet to actually complete.
Yeah, right. Now they are recruiting people for more advanced phases. They will recruit many more people, like 30,000, 100,000 people, and continue the studies. The problem is that we don't know what we are looking for as protection.
Absolutely.
The test will be when we test 2 groups. One group will get the vaccine, large group, one group will not get the vaccines, and we'll measure how many infections we had in each group. And only then we'll know for certain that we have a good vaccine.
Dr. Grappelli, the new coronavirus will mutate. In that sense, what does that mean for the vaccine and its testing?
I think it's very important to note that, yes, viruses, especially viruses with a genome made out of RNA, do have the possibility of mutating. However, when it comes to the coronaviruses, we need to understand that they have a very refined mechanism, actually, that is called proofreading breeding activity that actually corrects the mistakes. So when it comes to mutations, the likelihood of accumulation of mutations is much lower than, for example, in viruses like influenza virus or HIV virus. This is obviously very good news when it comes to vaccine, because the sequence that has been identified early in January, and also the one that is being used in the vast majority of the vaccines at the moment, means that at least will be likely be the sequences that are circulating for the near future, and therefore a vaccine designed based on that will likely at least be able to recognize. This is not a guarantee of success for a vaccine, but it's certainly good news when it comes to accumulation of mutations not necessarily happening in the coronaviruses.
Right. Here's hoping that these good news keep coming in till we actually reach the final stage. Professor Gostin, COVID-19 has now placed the spotlight on the elderly as the age demographic most in need of a vaccine. How well are scientists doing at tailoring immunization strategies for this population?
Well, I think the elderly will be one of the priority groups. My view is that we're going to have very high demand, over 6 billion people globally, for the vaccine. And there'll be, at least at the beginning, some scarcity, and maybe significant scarcity. Probably the first priority would go to frontline workers, particularly health workers, to keep the system moving. People who are vulnerable, like the elderly, or people with a number of pre-existing conditions, should also take priority. I hope that the clinical trials are, and I think they are, having a variety of individuals of different age, race, sex, and the like, so that we can actually make sure that the virus is well tailored. For example, with the elderly and influenza virus, you need high dose viruses for this particular group. We'll have to see how the virus is tailored to persons who are elderly or have an otherwise lower immune system.
Right. Let me bring in Dr. Gruppelli. Doctor, how effective can sewage testing prove to early detect and contain COVID-19 transmissions?
There's been a few studies around the world that have actually shown that testing of sewage can be quite informative. I think it needs to be put into the context and into the surveillance. And I think that now these studies have been generated and shared, and some of them are solid, provide solid data. It's very important that all the local authorities start looking and starting doing surveillance, not only in human beings, but also in sewage, in real time, not retrospectively like these studies have done.
Right. And Professor Panett, if I may just go back to vaccine testing, could the lack of time for vaccine testing increase the risk of foul-ups?
Yeah, of course. Normally developing a vaccine takes about 10 years, and it's a very slow process. Here we have a period that we try to make a vaccine in 1 year. The predictions are, I'm not sure that predictions are correct, but the predictions are that by the end of the year, we will have a vaccine. But even if we have a vaccine in a year and a half, that's very short time. So, of course, there are now about 20 vaccines which have entered clinical trials, and many of them will fall along the way. And we are not sure that the current vaccines, which are the most advanced one, will end as good vaccines.
So clearly time is going to be a challenging factor. Dr. Gruppelli, can bat research prove critical to prevent the pandemics in future? Also, experts have been proposing a decentralized system to monitor wildlife markets and other hotspots. Could global wildlife surveillance provide an early warning for the next pandemic?
Absolutely. This is something that is already up to a point in place for the other viruses, the influenza viruses, for which there is a fantastic network of surveillance. And there has been recently a report of an influenza virus with potential for a pandemic. And of course, only potential. It didn't happen. We don't know if it will happen. But this simply highlights the fact that the surveillance of, well, in this case, it's animals that are used, husbandry for human consumption. So actually, surveillance of these animals is quite important. For the coronaviruses, we need to move away from human interactions, but also looking at wildlife. So implementing this type of strategy and doing surveillance all over the world, in bats especially, because we know that they can carry many viruses. And obviously, most recently, we've also seen bats and Ebola in West Africa. And therefore, definitely need to keep looking and keep surveillance, because we do not know when and what will come. But of course, we do expect, again, this kind of spillovers of viruses into the human population with the potential of pandemics.
Right. Professor Panett, if I may bring you in on this, how crucial is the need for better disease forecasting in future? Give us an insight also into the challenges of modeling forecasts.
Yeah, first I would like to continue the last question which you asked.
Go ahead.
About viruses in nature. Thus far, we virologists have studied mostly human viruses and some domestic animal viruses. But there was very little effort to study viruses in nature. We know that there are about at least tenfold more viruses than all other animals and bacteria in nature. So there are huge number of viruses that we don't know. We don't know how to grow them. We have never characterized them. And I hope that this pandemic will convince people who are giving the money for research, the funding grants, to pay attention to what's happening in nature. And we know that we get all our viruses from animals. So next pandemic likely come from animals. And the prediction, it's quite impossible if we don't know what viruses are living among us in nature.
Professor Panett, that is actually a very significant point you've made. If I may bring in Professor Gostin on this. Professor Gostin, would you like to add anything to what Professor Panett had to say? He's clearly stated that animals are going to be the cause for the next upcoming pandemics. What do you have to say to that?
Well, I think all global health experts agree with that. We've known it way before coronavirus. Something over 60% of all outbreaks in the world originate from animal species. Ebola would be just one example of that. But yes, I think it's highly likely that there will be a zoonotic leap the way there was with COVID-19 that will, find its way into the human population. The truth is, we don't know when, we don't know what the animal vector will be, we don't know what the actual virus will be, but we do know that it will happen.
Professor, I'm sure you will agree, and the other panelists will also agree that there's a paucity of time here. So let me do a quick round of 3 questions with all 3 of you. If I may begin with you, Professor Gostin, which is that one country, in your opinion, that had the most effective policy in tackling COVID-19, and why?
Well, there are a few candidates, including South Korea, Taiwan, and others. I would say Taiwan was almost the perfect model for how we should tackle this. They did it through these digital location apps, very high rates of testing, contact tracing, isolation. They used universal mask wearing. face coverings.
Fair enough.
They had
Fair enough.
and consistent messages. So it was extraordinary.
Professor Panett, would you like to add anything? Which, according to you, which country was it with the most effective policy in terms of tackling COVID-19?
Well, I think you have New Zealand, which came out pretty well from it, as mentioned before, South Korea. And I should also add Germany came out pretty well. Israel came out pretty well from the first wave. And by the end of April, we had very little infection, very few. But then the government acted by opening everything, all the economy back, and in a month's time, and we are now in a second wave, which is even worse than the first wave. So governments should know that once the first wave is ending, they shouldn't open the economy without consideration and should be very careful in opening all society back to normal.
Reopening has to be a cautious one. I'm sorry, I'm running short of time. Let me take that question also from Dr. Groppelli. Doctor, please go ahead.
I absolutely echo what has already been said, and in my mind, my answer was New Zealand and Germany. And I'd like to just Germany simply because of all the European countries is the one that organized itself very quickly, very early, very efficiently. And it doesn't mean that it is going to be all easy for Germany, from now on. But certainly, I'm very sure that they got the start right, and so high hopes that they'll keep doing that, and we can learn from exactly what they've done back in January and February, actually, when the difference was made.
Let me also take one quick question with you. Could you name that one thing that will become our new normal even post the pandemic?
I think it will be potentially wearing masks, a face covering, and maybe, especially in the Western country, not shaking hands anymore. I think that will become the new normal.
Professor Panett, would you like to add anything to that? What, according to you, will be the new normal that is here to stay?
It might be social distancing, but I'm not sure that it will help for a long time. You know, people have short memory. So 1 year, 2 years, but then people will go back to their normal habits. I just want to add one comment about the WHO.
Sure.
I think the WHO is very important now.
Right.
And there is a lot of criticism on them. But without them, the world is in big problem concerning next pandemics.
Those are some very, very logical and rational thoughts. Dr. Groppelli, could I please have your closing thoughts?
In a nutshell, unprecedented times. This is a pandemic, it's a new virus, and it's been teaching us a lot about viruses, but also about society and about the world itself, our environment, our science, and also the need to come together when it comes to tackling it, because local is global and global is local, and we need to keep this in mind as we go forward for the future.
Very well said. Local is global and global is local. On that note, thank you so much, dear guests, for sharing those very precious insights with us. It's been a pleasure to have you on board. Now, according to historians, pandemics typically have two types of endings: the medical, which occurs when the incidence and death rates plummet, and the social, when the epidemic of fear about the disease wanes. Here's hoping a vaccine comes out soon and helps us conquer this disease medically and socially. For now, stopping transmission remains the only defense against COVID-19.
COVID-19 Health Summit.
Partnered by LIC. Arbal Abkesa.